the honourable member for North Island Powell River.
Well, thank you, Madam Speaker, and I'm very proud to be here to talk on this bill, and I appreciate that it's a difficult subject. I know that as a New Democrat, I'm incredibly proud of the fact that in 2004, Canadians overwhelmingly voted for Tommy Douglas as the greatest Canadian because he was the father of Medicare. So I think when we think about Medicare, it's something that's just right in our blood. We believe in it foundationally, and it's something that we all want to see continue to grow and progress in this country. But we know that the reality is that it's in crisis. And I know this very well. I know this because of the realities in my riding. In my riding, there are currently 2 hospitals that have no emergency room at night. They shut down. One of those communities is on Corman Island. It's an island, Madam Speaker. So if something happens to someone at a time when that hospital is closed, they have to find a way off of the island to try to go get help. Or I think of Port Hardy, where it was very much in the news. Madam Speaker, there was one time where somebody was going to the hospital, to the emergency room with a very serious issue, arrived and found out it was closed, collapsed, and they had to get an ambulance to drive him over 30 minutes to the nearest hospital. And he was lucky because he wasn't on an island. He was lucky because when he got there, that hospital wasn't closed that day. The reality is, during a period of time, we had sudden emergency room closures, often Facebook posts, just to let people know in that community, your hospital isn't open for emergencies for this evening. So we know now that this is devastating. It's devastating to communities. I've had so many constituents contact me and let me know how afraid they are. And they are having such a hard time attracting doctors, staff, nurses. They're burning out. It's huge. And Madam Speaker, one thing that I think we have to continue to talk about is that when that happens, especially for rural and remote communities who have a very unique experience in this country, not only do they lose their emergency access and often have to travel far anyways just to get any kind of specialist appointment, now when they're looking at strategies to attract and retain people, it's harder for them. So they're trying to rebuild their communities, rebuild their economies, but they can't even say to people, if you come to our community to work and live here, there's going to be an emergency room open if something happens to you. Now recently, the BC NDP stepped up and put $30 million to help. Part of that help meant that they had to close 2 of those hospitals for emergency at nighttime. But what was different is it wasn't happening all the time. Now they actually have some of the resources to start to have an attraction and retention strategy to get more of the healthcare providers that they desperately need in that region. But the reality is, in Port Hardy, between 7 a.m. to 5 p.m., they have emergency services. After 5 p.m. until 7 a.m., they have none. And in Corman Island, between 8 a.m. and 7 p.m., they have emergency services, but after 7 p.m., they have none. And remember, Madam Speaker, they have to take a ferry to get help or be helicoptered off the island. Now, why I am here and why I will support this bill is because my constituents are pleading for help, and I don't believe that this government is standing up to support them. We need those resources flowing. We know something has fundamentally changed in this country, and Medicare is worth fighting for. So we need to see that this crisis is happening and that privatization is growing. It's growing in this country. And why should we be afraid of privatization? And why should we be concerned when the Prime Minister during an election makes fun of the Conservative leader, he's saying privatization is innovation and that's wrong. And then a little while later, he's saying to Doug Ford, that's innovation, good for you. That's the discrepancy here. So I really hope people in this House listen to that, because that is a clear discrepancy, and I think all Canadians need to be drawn aware to that. One of my riding's biggest public health advocates, is Lois Jarvis. She is relentless. This woman fights every day for public health care, and I appreciate and respect her so much. Madam Speaker, when the communities of Campbell River and Comox Valley were getting hospitals built, she fought like hell to make sure that they would have free parking And you know why she fought for free parking? Because those two hospitals serve communities all around that have to, or serve communities from all around that have to come a far distance to get health care. And she didn't want them to drive hours, take ferries, and then have to pay for parking on top of it. So she fought for it. She fights for private or for public health care, so I will as well. We know for a fact that private clinics across Canada are advertising you can get your procedure done here so much faster, it's going to cost you $28,000. But we know that Medicare in Canada does the same service for just over $12,000. Privatization is always about making profit. It is not about helping people. And that is why the NDP will get up every single day and fight for this system. Tommy Douglas built it. We all know what he went through to make it happen. So it's shameful for the Liberals to take credit for somebody's hard work and inspiration in this country and how finally the federal government listened to making sure it happened for every Canadian. So I will stand up every day and I will tell you, Madam Speaker, if it does not pass the Lois Jarvis smell test, then I won't have it. And right now what is happening in this country does not pass her smell test. She knows that privatization is creeping. It's creeping and creeping. And you know what that means? It means Indigenous communities with even worse health outcomes. It means people who are marginally, economically marginalized, I apologize, will be more and more ridden with disease. And our system will fail them. It's already failing too many Canadians. So yes, I'll stand up in this House. Yes, I will fight for health care. And I certainly hope that everybody in this House has the bravery to do the same. Thank you.
Questions and comments? The Honourable Member for Fredericton.
Thank you, Madam Speaker, and I thank the Honourable Member for North Island Powell River for her speech today. I also come from a province where we're seeing ERs closed. People are dying waiting to receive care. It's absolutely at crisis levels. And you know what's not helping them? Is games being played in this House, which is exactly what this motion demonstrates. So I'm going to allow the member to cut through a lot of the unhelpful pieces of this and maybe speak to the piece about enforcing the Canada Health Act and immediately move to close loopholes that allow for the growth of the two-tier healthcare system. I'd like to hear more about that specifically. Thank you, Madam Speaker.
The Honourable Member for North Island Powell River.
Madam Speaker, I'm really disappointed that this member does not see the reality that's happening on the ground, and that the fact that the federal contribution to healthcare used to be substantively more, and every different government, it goes down, it goes down, it goes down. This is about saying that across this country we deserve healthcare for everyone, and that means the federal government has to take that part up. So I'll tell you what's happening with loopholes. Private companies in this country are inviting people from one province to another to get help at a much higher rate. You know, when you look at this administratively in the U.S., it's over 30% administrative costs. When it comes to Medicare, it's less than 2% administrative costs. This makes sense. It's the best for the economy, it's best for the community, and it's the best for healthcare in Canada. So I hope she will fight for that just as strongly as I'm willing to.
Questions and comments?